Okay, over here we have why breast cancer is increasing with the increase of abortion. Um, I remember not even growing up hearing about breast cancer at all when I was younger. And it wasn't because I was naive, it's because people didn't really have it, right? And then when I got into about my childbearing years, I heard about tons of people who had breast cancer. It was like it was in the water. It says here the single most important factor in a woman's risk for breast cancer is her age at the time she brings her first pregnancy to term. And that's because there's basically type 1 and type 2 tissue until she has a type 4 tissue, which is in her pregnancy. And once she has that, she's usually safe from breast cancer. So 99% of breast cancers arise from type 1 and type 2 breast tissue. Type 4 milk producing breast tissue is permanently cancer resistant. So once a woman has taken a pregnancy past 32 weeks, she has significantly decreased her chances of ever developing breast cancer. That is why age at the first pregnancy is the single most important deterrent, I got distracted, of breast cancer risk. The earlier she brings her first pregnancy to term, the lower her risk. The older she is when she brings her first pregnancy to term, the higher her risk. The fact is universally recognized and undisputed. I never heard of this. Never. It says this is why nuns tend to develop breast cancer. In fact, almost all breast cancer risk factors boil down to two questions. How much immature type 1 and 2 breast tissues do I have? And how long have I had immature type 1 and 2 tissue before maturing the tissue to milk production? So, there's a lot of studies here of how destructive it is concerning breast cancer.